Hi everyone, welcome to Medicine Art YouTube channel. In this video, we are going to see about a treatment which is incision and drainage. It is important in surgery aspect view. The incision and drainage is a surgical procedure carried out to relieve pus. It is a surgical procedure where the incision and drainage is a surgical procedure which is done to relieve the pus. Mainly the incision and drainage is done in pyogenic abscess. Mainly these incision and drainage are done in pyogenic abscess. The incision is contraindicated for cold abscess. As I have already uploaded a video in cold abscess, please do watch it. Why this incision is contraindicated in that cold abscess I have said in the video. Please do watch that before watching this. Incision and drainage is contraindicated in the cold abscess. During the incision and the drainage, the position of the patient should be supine. The patient should be supine, prone to lateral depending upon the site of the abscess. According to the site of the abscess where it is present, the patient should be supine as well as prone, or he should be turned to the lateral where the abscess is generally present. According to it, the patient is positioned. The procedure of this incision and drainage is, for this procedure, we generally prefer general anesthesia because the abscess is acidic in content, so that the LA, local anesthesia, does not work there. So that we generally prefer general anesthesia. For this procedure, the preferred anesthesia is general anesthesia because the abscess is multiloculated and the infiltration of the lignocaine into the abscess cavity does not act because the acidic of pH of the pus. The acidic pH of the pus, which makes the lignocaine not to work. However, a superficial abscess which is pointing can be managed without general anesthesia. The superficial abscess, when the abscess is present superficially, it can be managed by the general anesthesia. Provide a stab incision over the most prominent part of the swelling part, which is red. Skin is thinned out over it and it is pointed. We should give a stab inside the most prominent part which is red and the skin is thinned and the most pointed area. An incision given and the pus comes out of the swelling and it should be sent for the culture sensitivity. There should be an incision given and the pus comes out from the abscess should be sent for the culture sensitivity. A sinus forceps or a finger should be introduced into the abscess cavity. All the loculi inside the cavity should be broken and now the fresh blood oozes out from the cavity. This finalizes the complete procedure of the incision and drainage. After it, when the cavity should be irrigated with the hydrogen peroxide solution and the iodine solution. After the using of forceps or finger is introduced into the abscess cavity and all the loculi present inside the cavity are broken and all the pus comes out from the cavity and until the fresh blood oozes out. And when the fresh blood oozes out, this signifies the completion of the incision and drainage procedure. After it, we should introduce hydrogen peroxide or iodine into the cavity, and then when the size of the cavity is big, we should pack a roller of gauze. We should pack a gauze which is soaked into the iodine and which is kept in the abscess cavity, so that this cavity does not close for 24 to 48 hours. The packing helps in controlling of the bleeding. This also helps in controlling of the bleeding. Due to this packing, the opening of the abscess cavity does not close. By the 7th and the 10th day, the cavity collapses spontaneously and the granulation tissue fills up the cavity and the healing starts here. After the 7 to 10 days, the there is collapsation occurs and the granulation tissue starts forming, and this signifies the healing of the cavity. An abscess should be closed as it contains bacteria. It should be drained out. Post-operative management. After this incision and drainage, proper antibiotics should be given for the patient. Controlled diabetes should be done if the patient is diabetic. Regular dressing of the wound is done by the antiseptic solution. These are the post-operative management of this incision and drainage. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it.